The government of India holds these regular briefings to tell people what's happening with COVID-19, and a very important statement was made at those briefings, one of which took place this afternoon by the principal scientific advisor, Dr. Vijay. He said in no uncertain terms that a third wave of COVID-19 is inevitable. The time and the scale of that wave is not known right now. Now, this is coming at a time when we're still grappling and wondering how to beat the second wave. We don't know where the peak of the second wave will be. Meanwhile, here's the latest in terms of numbers coming in from COVID-19. 3.8 lakh cases or thereabouts was the daily figure of the last 24 hours. Fatalities are also increasing. It's a record number of 3,780, making it the highest single-day death toll since the start of the pandemic. Let's first listen in to what the principal scientific advisor said today.
Coronavirus to go from here. A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore, we should be prepared scientifically to take care of that. So B117, other variants like 617 are accumulating changes which show excellent vaccines, on which vaccines show excellent efficacy.
All right, meanwhile, let's turn our focus to Karnataka for a bit, because the state of Karnataka seems to be turning into the next big hotspot. Over 50,000 positive cases in the last 24 hours and more than 20,000 just in the city of Bengaluru. In fact, in a hearing today, the Karnataka High Court rapped the centre, asking them why oxygen quota for the state has not increased yet. To speak more on what's happening, especially in the city of Bengaluru, I'm going across to Nisha Hebbale of the Times Network. Nisha, a lot of reports coming in of spaces in hospitals running out as well. What are you observing on ground? Neha, if you can hear me.
Well, in fact, like we've been bringing stories of how the cases over here are increasing, the kind of, dearth of beds, dearth of oxygen that we're seeing, and what a terrible situation it's turned out to be over here in the state of Karnataka. Let's just give you an understanding. As of now, Karnataka, or Bengaluru in particular, has the highest number of active cases even today across the country. It's in fact, even today in the High Court, the hearing that was held, the High Court not only pulled up the central government for not increasing the allocation, but a direction was passed to the central government to increase Karnataka's allocation of oxygen. To put this in perspective, in the past, about 4 days now, nearly 40 deaths, close to about 40 deaths have been reported in the state just merely because of oxygen disruptions in various hospitals. So even as we're talking about this, Karnataka, of course, had imposed a 14-day lockdown last week. This was in fact imposed last week. So with that also being said, it is in fact rising, and rising at a very quick pace, if we can say that. 50,000 cases today, that's a new high that the state has never reported before. So we'll have to wait and see. Of course, now even on the bed situation, there is quite a bit that's happening over here in the state of Karnataka with no oxygen beds, no ventilator beds. We've done several checks, and tomorrow the High Court would be hearing the issue of the bed availability and also of shortage of remdesivir in the state.
All right. Thank you so much for those details, Neha Hebbale. We have to keep an eye on all the big cities as well on what is happening, because clearly there is a pattern that the COVID-19 follows. We saw Mumbai at the epicenter of it a few weeks ago. Trouble has shifted to Delhi, which is still grappling, and now reports coming in from Bengaluru. Let me now turn my attention to the other big story of the day and what the Reserve Bank of India said today. It was an unscheduled address that Governor Shaktikanta held, and the basic message was that we are very much here. We're very much cognizant that there's a second wave hitting India. And while there were no projections of exactly what he thinks it will do to the economy, we'll have to wait for the next MPC meet perhaps to know that, a lifeline was extended, help was extended. So a second window has been given to individual and small borrowers with exposure of up to 25 crores if their accounts are in order as of recently, and if they have not availed of any help in the first round of moratoriums last year. So they will get some facility and a moratorium really for up to 2 years. Those who have availed of moratorium last year will also get the option of an extension. There were several other measures that the governor also announced. Let us take you through what he said today.
As in the recent past, the Reserve Bank will continue to monitor the emerging situation and deploy all resources and instruments at its command in the service of the nation, especially for our citizens, business entities and institutions beleaguered by the second wave. The devastating speed with which the virus affects different regions of the country has to be matched by swift-footed and wide-ranging actions that are calibrated, sequenced and well-timed so as to reach out to various sections of society and business right down to the smallest and the most vulnerable. Since the pandemic began, I have on several occasions expressed my genuine faith in India's resilience and capacity to overcome all odds. With restrictions and containment measures being localized and targeted, businesses and households are learning to adapt. Consequently, the dent to aggregate demand is expected to be moderate in comparison to a year ago. Reports suggest that the disruption in manufacturing units so far is minimal. Consumption demand is holding up, with sales of consumer goods rising in double digits in January to March, and average daily electricity generation up by 40% year-on-year in the month of April. Term liquidity facility of rupees 50,000 crore to ease access to emergency health services. To boost provision of immediate liquidity for ramping up COVID-related healthcare infrastructure and services in the country, an on-tap liquidity window of rupees 50,000 crores, rupees 50,000 crore with tenor of up to 3 years at the repo rate is being opened till March 31st, 2022. That is March 31st of next year. Under the scheme, banks can provide fresh lending support to a wide ranging of entities including vaccine manufacturers, importers and suppliers of vaccine and priority medical devices, hospitals and dispensaries, pathology labs, manufacturers and suppliers of oxygen and ventilators, importers of vaccine and COVID-related drugs, logistics firms and also patients for treatment. Banks are being incentivized for quick delivery of credit under the scheme through extension of priority sector classification to such lending, and this facility will be available up to 31st March next year, that is 31st March of 2022. These loans will continue to be classified under priority sector till repayment or maturity, whichever is earlier.
All right, so Governor Das also saying that this won't be the only measures, more will be unveiled in the days to come, depending on how the situation unfolds. Now, that's the question. What will be the impact of the second wave? So far, the understanding has been largely that because this second wave was not coupled with a nationwide lockdown, the impact would be limited. Even the kind of restrictions that you've seen in most places, and perhaps the most severe of them in Maharashtra, still allows manufacturing to continue. Most things are allowed to continue. And other businesses, as the governor also said today, have learned to adapt. At least some businesses have. Having said that, looking at how effective this wave is and how it is ripping through people and the medical infrastructure, Can the impact be restricted anymore? To speak on this, I'm joined today by Kaushik Das, Director India of Deutsche Bank Research, Rahul Bajoria, Chief India Economist at Barclays, and Puja Mehra, author and journalist. Welcome to all of you, and thank you for speaking with us today. Mr. Das, let me start by getting your view. Very simply put, how bad is it going to get? We heard from S&P today, which has given two scenarios. One is that infections peak by May, and another if they peak by June end. If they peak by June end, they have downgraded their GDP forecast by close to 3% in that case.
Hi, Tamanna. As all of us know, this is a very fluid situation, and the base case scenario remains, according to a lot of forecasts, that by mid-May, we would expect this COVID-19 second wave to kind of peak. But as you mentioned earlier, in this channel, that different states are seeing different kinds of peak of COVID-19 wave. For example, Maharashtra probably has already seen the peak because they went for a lockdown on April 5th. The states which were, announcing the lockdown a little later would see the, numbers kind of peaking with a lag. For example, Karnataka, as you said, is seeing a higher number now. So different states are showing different, COVID-19 trajectory. But for the country as a whole, we would expect by mid-May the numbers to kind of peak. The last few days, the signs are already good. From 1st May, the numbers, the new cases were above 4 lakh. From there, it has come down a bit. If this sustains, then by mid-May, you could expect the peak to be achieved. In that kind of a scenario, the forecast that RBI has, which we also have, Deutsche Bank also has a 10.5% year-on-year growth forecast for FY22. I think that can still be achieved. That is primarily because we have a very favorable base effect from last year. Last year, FY21 growth was down -8%. So all the year-on-year growth numbers, if you've seen the export numbers, they were up 197% year-on-year in April. So those kind of numbers will continue because of the favorable base, and you could get to 10.5%. But in the adverse scenario where the lockdowns that are there in the almost all the states in the country, if they get extended to June and beyond, or in case at some point the government is forced to announce a nationwide lockdown, then obviously we could think of a scenario where growth could fall to just about, say, 8%, which is just neutralizing the -8% of last year, and in 2 years you'll be just at 0%. So things are very fluid. The next 2 weeks would be very critical to kind of watch out for to finalize any kind of forecast.
Rahul Bajoria, at this point, and there are no scientists or doctors in this panel, so I'm not going to ask anyone to guess when the second wave is, but peaking and beginning to peter out by mid-May is looking difficult right now, simply because cases are rising, and there are states now where cases are still on the upswing. Does that make the situation a little more harder to predict?
Absolutely, Tamanna. I think, if you look at the first wave, it went on for about 25 weeks. And, with this whole idea of moving epicenters, across the geography, which is quite wide in India, it is going to be, difficult to really say that, you're going to have a very early peak out. And so in our base scenario, we think that mobility restrictions, even if there's a peak in mid-May, as quite a few people are expecting, mobility restrictions stay with us at least till end June, if not for longer. And so the economic scenario has to be derived not so much as to when the cases peak out, but more around, when do governments actually ease up on mobility? When do, individual households and businesses feel that, normalcy has been restored? And there, I think, it's hard to see how in this first quarter of the fiscal itself, you see any normalcy come back. At least I think some kind of mobility restrictions, whether regionally or, some kind of a national picture, which sort of emerges as a conglomeration of all the states putting some restrictions, is going to likely to stay with us. Our sense is also that the economic losses are just a fraction of what it was last year. But then at the same time, I would say, vaccinations are really the key. If we are able to scale up vaccinations, I think the confidence, particularly within the consuming class, is going to come back, that they can start engaging in economic activity once again without really fear of, getting hospitalized or, without fear of, mortality, etc.
No, so let's be honest, the vaccinations are not going to happen for a while. I was just looking at the figures of the amount of vaccinations which have taken place in the 18 to 44 age group since the 1st of May, since it started, is about 6.7 lakhs. That's not even 1.5 lakhs a day. We've already had Serum Institute of India making it very clear that they will take time to ramp up their capacities. That's also turning out to be a drop in the ocean. Having said that, Puja, from what we can see right now, what are the indicators we need to look at? We still have to wait for the quarterly GDP data to come, for all of the data points that the government puts out to come. But right now, where is the biggest hit going to be, considering you have a virus which is spreading fairly rapidly, you have medical infrastructure which is creaking, and you have a vaccine program which is short of supplies?
And I want to broaden your debate to include just the human suffering, the magnitude of the human suffering, especially when I look around me in Delhi, because a lot of the lives lost in this particular wave, which is now peaking, or maybe about to peak, as the experts are saying. A lot of these people are youngsters at the prime of their working age, in very good jobs, high-paying jobs. So there is there's a cost in those terms also. I think we need to keep watching also, the human angle of the losses, that have been felt on that side. And you speak of the vaccination drive. I think the key thing this time round this year, as far as the economic crisis is concerned, is not the lockdown, but the vaccination drive, because it is the health crisis this time that is far more, at least from what I see around me, it's the health crisis that is far more important than the lockdown. And the only way you're going to be able to make sure that people can step out of home and get to work safely is, when they're fully vaccinated. As of now, just about 10% of the population has received one dose of the vaccination in India, compared to close to 50% in a lot of other countries. So we have to get people vaccinated, the second dose, if required, the third dose. And then, there is a waiting period. You do not immediately become, you can't throw caution to wind and step out and begin to go to work every day. So I think the main thing this time that we have to watch is not the lockdowns, but the vaccination drive. That is going to be the key in making sure what your losses of lives and livelihoods is going to be. I think we are not capturing in our narrative sufficiently the spread of the virus this time around. I mean, I'll give you an example. Whoever I'm calling these days in Delhi, in government, whether it's for my work or just to find out how people are doing, I can tell you that most people tell me that they're down with COVID. I don't think the numbers are officially coming out, and I do think that the government should put out numbers of the kind of spread, how much government employees are infected by the virus, because I think that's a very important factor. And at some point, we are going to have to begin to look at how much the virus is taking a toll in terms of our policy-making capacity, our all kinds of other kinds of capacity, decision-making capacity, business capacity, etc. So that's why I'm saying that I think the thing to look at is not the physical mobility, but the human suffering and the human cost.
No, completely agree. The human suffering and human cost is immense. I mean, this is what we focus on day in and day out, about how people are grappling. And yes, it is going to impact productivity. There's no question about it. What we need to know is to what extent. Kaushik Das, how do you go about the business of trying to figure out how big the hit will be. So now, for example, yesterday we spoke to Mahesh Vyas of CMIE, who's telling us that the unemployment rate, which he tracks, is at a 4-month high at close to 8%, and in urban India it is close to double digit. But this is not necessarily because of second wave. The impact of second wave is yet to play out. What are the factors that you are looking at?
So, it's a variety of factors, and, what Rahul just spoke about, that even if the cases peak in mid-May, when is the time when people would feel comfortable to venture out and, kind of go for their work? And that is that is dependent in a big way on how quickly you can vaccinate people. And as Puja said, that there is a, waiting time period by which you can get the second dose and then, get some bit of immunity. So in between, you'll have June to September period when you'll have monsoon season, when anyway, things will slow down. So there are a lot of, kind of moving parts at this point of time. If you get a 10% growth, it sounds very high just on a year-on-year basis. But I can tell you that because it is minus 8% last year, this 10% or 10.5% is not good at all. I mean, in fact, people were expecting growth to be 12-13%. I mean, assuming that incrementally the economy would kind of do well. But the way to look at it is not just in terms of year-on-year momentum. We also look at in terms of the sequential momentum, which you can calculate based on the quarter-on-quarter movement or the month-on-month movement after seasonally adjusting the data. Then you can look at the output gap, which is there in the economy, which means at what level the economy is operating compared to its potential. So just to answer to your question about what you spoke about earlier, that there is a possibility of a third wave. I think we should learn from whatever we are going through in the second wave, so that we have, if we have a mild third wave, it is mild and people follow those protocols. But I think the long-term scarring effects will be there in FY23 as well. So we are pretty conservative with our growth forecast for FY23 as well at 5.5% to 6%. And I think there will be some spillover impact from this year into next year as well.
Let's talk a bit about the third wave and what happens there. So as states and as policymakers are hopefully beginning to prepare for the third wave, considering we found ourselves completely out of depth for the second wave, will businesses also have to prepare for the third wave? So we heard from Uday Kotak recently saying that all his employees and everyone who works in his organization is going to be working from home, except those mandated by law to come in. More and more companies are going to start to look at models where perhaps productivity will be hampered, and they will make priority the lives of their employees. Will all of this then start to add up, Mr. Bajoria, especially if you take into account a possible third wave?
Really depends on the magnitude and the severity of the third wave, which will dictate what is the economic impact and what is the human cost of it, right? And it also depends on the time, because I think if you just look at, the extrapolated vaccine supply timeline at the moment, it is still likely that most major Indian cities are going to have at least 1/3 vaccine coverage by the month of July. And we are going to probably have, about 2/3 coverage probably by the end of the third quarter itself. Several cities are going to hit that threshold. Now, with that, if we assume that there is a third wave, maybe the mortality rates are going to come down very significantly. So even if cases are increasing, it is likely that you're not going to see even the similar kind of an impact what we are seeing right now, which is already a fraction of what the impact was like. I think the whole productivity model, the business model change is going to have both pros and cons to it. I think, there will be some productivity gains as well. We saw last year that, during the peak period of the pandemic, in the first wave, companies actually were able to increase profits in several cases because their cost bases, rationalized. There was, an element of, say, travel going down. There was quite a bit of time saving, through a lot of virtual activity. So I think it's still a bit too early for us to conclude that there will be significant amount of scarring. I think, I do sympathize with what Kaushik said, that it is very uncertain at the moment. So I think, the risk is, and we should be absolutely careful towards that. But then it is still unclear, how this entire thing unfolds, because the third wave, while quite likely, and if the scientific advisor is saying that we should take it very seriously, I think what we really have to wait and see is what is the magnitude and what is the timeline and how much progress do we make in vaccinations by the time the third wave comes to us.
He's saying it's inevitable, and that's coming from the top. So we have to be prepared for it. Puja, I want you to talk about the parts of the economy which just do not have a spotlight on them, but are the major, basis for the economy moving. I'm talking about labor, which does not get counted in all of the statistics. I'm talking about the informal parts of the economy and the kind of hit that they will be facing for the second consecutive year in a row, and possibly in the third wave as well. What needs to be done to ensure that segment doesn't go under?
So, Tamanna, as you know, more than 90% of the laborers in the informal sector and also large parts of nearly 50% of GVA comes from the informal sector. And that includes, things like trade, things like repairs, all kinds of, when you see around small tailoring shops, etc. Those people do not have, the kind of support that the formal economy has in terms of credit lines, etc. They've already had 1 year of disruption. In fact, before this, they've had disruption because of demonetization. A lot of the slightly bigger companies have had disruption because they've lost out market share to more organized companies because of the disruption due to GST. So it's just been, one after the other, a lot of shocks to this part of the economy. And I think there have to be some fiscal measures for this part of the economy. I don't think we can rely on monetary policy to reach this part of the economy. And this part of the economy, since, there was some there were some RBI announcements today, I also want to highlight that, maybe it's time to begin to ask the RBI, is it just printing too much money in the name of liquidity? Because consistently now we are seeing inflation pressures on structural elements like food and core. And the informal economy is what takes the biggest hit, when we see a situation of low growth and high inflation. And, we've had a negative double-digit nominal growth last year. And yet you have high inflation. At the same time, you have so much liquidity being pumped in. So, are we going in the right direction is a question that experts would need to begin to discuss with the RBI now. And this part of the economy really needs fiscal measures. I really don't know. They're outside the tax net. So I don't know if any tax measures are going to be able to help them. Most of them do not get bank credit. So I don't know any of these announcements that the RBI makes is going to help them. So you just have to go and give them money. That's just what can be done. And even there, I don't think they have any touch points with policy.
Perhaps.
So, biggest challenge.
Perhaps we've come to that stage. Perhaps more Manrega allocations, perhaps more money is going into Jan Dhan accounts are the way to go. Thank you so much to all of you for joining us on the first big debate this evening. We'll take a very short break, but don't go anywhere, because the next segment is something that everyone's talking about, everyone's thinking about. It is all of you who are parents, possibly grandparents out there. Should schools reduce their fees at a time when education is continuing to be online? It's not as simple as it sounds. The answers are not as simple as it sounds. Yes, parents want fees reduced, but can schools continue to give the quality of education they have to with reduced fees? We're going to get you both sides of the story after this break. I will be joined by Surabhi Goyal of the Aditya Birla Education Trust Schools, Ashok Agarwal, National President of the All India Parents Association, and Cyrus Vakil, Principal of the Bombay International School, after this very short break.